Hello, my name is Hanadi Alolimi. Welcome to the second episode of the FIP CPD Bite series on period pain. This episode will provide insights into how pharmacists can effectively manage secondary dysmenorrhea in community pharmacies. By the end of this episode, you should be able to provide guidance for the initial management of secondary dysmenorrhea at the community pharmacy, explore effective approaches for managing secondary dysmenorrhea unresponsive to initial treatment, and offer guidance on further investigation and referrals for specialized care. The initial management of secondary dysmenorrhea at a community pharmacy typically involves both pharmacological and non-pharmacological approaches, with the goal of alleviating symptoms and addressing underlying causes. Secondary dysmenorrhea is often due to conditions like endometriosis, fibroids, pelvic inflammatory disease, or PID, or adenomyosis. So treatment may require more tailored intervention than for primary dysmenorrhea. Some evidence-based approaches to its management include the pharmacological management, like nonsteroidal anti-inflammatory drugs or NSAIDs. NSAIDs, like ibuprofen or naproxen, reduce prostaglandin production, which elevate menstrual cramps and pain. NSAIDs are indicated as a first-line treatment for dysmenorrhea, including secondary dysmenorrhea, especially when inflammation is a significant factor, for example, in endometriosis or PID. The hormonal contraceptives, combined oral contraceptives, progestin-only pills, and hormonal intrauterine devices suppress ovulation and reduce menstrual flow, helping to control conditions like endometriosis and adenomyosis that contribute to secondary dysmenorrhea. Women can be advised to consult with their doctor for a prescription, but pharmacists can provide information on how hormonal contraceptives may help regulate symptoms. Over-the-counter or OTC analgesics like paracetamol, while it's not as effective as NSAID, acetaminophen is an alternative for women who cannot tolerate NSAIDs. Also, antispasmodics or OTC medicines like hyoscine butylbromide can relieve cramping by relaxing smooth muscles in the uterus, though evidence of their efficacy is limited compared to NSAIDs. Referral to a doctor if OTC medicines are not sufficient. Pharmacists should advise women to seek medical advice. Prescription medicines such as gonadotropin-releasing hormone agonists may be necessary for treating severe conditions like endometriosis. The second approach is the non-pharmacological management, like heat therapy. The mechanism of action is the application of heat. For example, heating baths relaxes uterine muscles and increase blood flow, helping to reduce menstrual pain. Dietary and lifestyle modification, encouraging an anti-inflammatory diet rich in omega-3 fatty acids found in fish oil and antioxidants from fruits and vegetables can help reduce inflammation associated with conditions like endometriosis. Reducing caffeine and alcohol intake, both of which can worsen cramping and inflammation, is recommended. Exercise, like physical activity, helps release endorphins, which are natural pain relievers, and improves blood circulation, which may help reduce cramping. Pharmacists can recommend light to moderate exercise like walking or yoga, especially during the non-menstrual phase. Stress reduction and mindfulness-based intervention, including meditation and relaxation techniques, helps reduce stress, which can exacerbate the perception of pain. Pharmacists can suggest mindfulness apps or recommend seeking professional guidance on stress management techniques at the pharmacy. When to refer if initial OTC treatment is ineffective or if the patient presents with severe or atypical symptoms. For example, heavy bleeding, pain outside of menstruation, and dyspareunia. Referral to a healthcare provider is necessary to assess and treat underlying conditions such as fibroids, endometriosis, or PID. Consultation with a specialist for severe cases of secondary dysmenorrhea, prescription treatments. For example, gonadotropin-releasing hormone agonists or progestins or surgical interventions may be required, and pharmacists should advise patients on when to seek further medical evaluation. For women with secondary dysmenorrhea unresponsive to initial treatment, further care involves 1. Advanced pharmacological therapy, for example, gonadotropin-releasing hormone agonist antagonist, progestin-based treatment. 2. Advanced diagnostic evolution, for example, imaging laparoscopy. 3. Surgical interventions, for example, excision of endometriosis, myomectomy, or hysterectomy. 4. Multidisciplinary pain management and psychological support may also be necessary to manage refractory symptoms and improve quality of life. The key takeaways are the management of secondary dysmenorrhea in pharmacies involves pharmacological and non-pharmacological treatments. Pharmacists should refer patients to healthcare providers if symptoms persist, are severe, or require advanced treatment beyond OTC options. When initial treatment fails, advanced therapies, diagnostic evaluation, and surgery may be necessary, and pharmacists play an important role in educating patients. Thank you.